Dr. Eric Weiner, a breast oncologist at Yale Medicine, is dedicated to reducing the racial disparities in breast cancer. He is troubled by the fact that young Black American women have double the chance of dying from breast cancer before the age of 50 compared to young white American women. One possible reason for this disparity is the higher rates of triple-negative breast cancer, TNBC, in Black women. TNBC is diagnosed nearly 3 times more often in Black women, and it is also typically found at a later stage and is more deadly for this group. While there is no single reason for these disparities, experts want Black women with metastatic TNBC or those at risk for the disease to know that it is treatable. Dr. Kimberley Lee, a breast oncologist at Moffitt Cancer Center, emphasizes that Black women respond to the treatments available, and it's important for them to remain hopeful despite the existing disparities. Triple-negative breast cancer, TNBC, makes up around 15% to 30% of all breast cancers in Black women, while it's only around 5% to 10% for non-Hispanic white women. The reasons for these large racial disparities are not completely understood, but researchers have some ideas. One reason could be age and breast tissue density. TNBC is more common in Black women under 55 who have very dense breasts, which can make it difficult for mammograms to detect tumors early on. Reproductive habits also play a role. The chances of developing TNBC seem to increase with the number of children a woman has, and breastfeeding can help lower the risk. However, Black women are less likely to breastfeed or breastfeed for shorter periods. Obesity may also contribute to the higher rates of TNBC in Black women. Research suggests that obesity can lead to inflammation that promotes TNBC, and Black women tend to have higher levels of body fat. However, the link between higher body mass index, BMI, and TNBC is not fully understood. Additionally, genetic differences may be involved. Although non-biological risk factors play a part in the racial disparities in TNBC, there are likely genetic factors at play as well. However, researchers have not yet identified these genetic differences, and populations with Black and African ancestry are often underrepresented in genetic studies. Triple-negative breast cancer, also known as TNBC, is a type of breast cancer that does not have any hormones to target. This makes it more challenging to treat and reduces the chances of success for everyone. However, researchers are investigating whether there are specific factors related to tumors in Black women that make the cancer more aggressive from the beginning. It is believed that genetic differences may only play a small role in the higher death rates experienced by Black women with TNBC. Instead, factors such as racism, poverty, and limited access to healthcare and education may have a larger impact on the outcomes for this group. Studies have shown that Black women often face more barriers to accessing proper care for their breast cancer. This includes lower household income, higher rates of Medicaid or no insurance, and difficulties with transportation. Additionally, financial strain can increase the risk of death for people with breast cancer, with the chances of dying being significantly higher for those who experience bankruptcy. Socioeconomic status also plays a role in the disparities seen in TNBC. People with lower socioeconomic status are more likely to be diagnosed with advanced breast cancer, leading to delays or interruptions in treatment. Furthermore, Black women are less likely to receive standard breast cancer care, including surgery, chemotherapy, and other treatments that can improve survival rates. Another factor contributing to racial disparities in TNBC is the lack of Black doctors providing cancer care to Black women. This can lead to a sense of mistrust and impact the quality of treatment received. Addressing these disparities is crucial to improving outcomes for all women with TNBC. One way to improve your cancer care is to ask about genetic testing. If you have a strong family history of breast or ovarian cancer, you should tell your doctor because your odds of TNBC increase if you test positive for the BRCA1 gene mutation. Your doctor can help you find out if genetic counseling or testing is right for you. Once you know you have a genetic mutation, you can ask your doctor about preventive strategies to manage your breast cancer risk. Another step you can take is to bring up breast density. Not everyone with dense breast tissue gets breast cancer, but if you're a Black woman at higher risk of TNBC, you might benefit from breast MRIs or more frequent breast cancer screenings. You can also talk to a patient navigator, who can help you overcome personal barriers to treatment. They can help set up child care, rides to appointments, copay assistance, or financial aid. If you're not sure who to talk to, you can reach out to the Patient Advocate Foundation, a nonprofit group that provides professional case management services to people with chronic or life-threatening illnesses like cancer. Researchers are trying to understand why Black women are more likely to get triple-negative breast cancer, TNBC, compared to other groups. There is a need to focus on reducing the differences in breast cancer treatment for different racial groups. Some of the questions researchers are trying to answer include: are doctors providing the right treatment at the right time for Black women? Are doctors communicating treatment options effectively to Black women compared to white women? Do Black women face more financial difficulties in paying for treatment? Are doctors following up enough on the importance of early and effective treatment for Black women? Do Black women have tumors that do not respond well to common cancer drugs? Can community outreach efforts help improve breast cancer screenings and ensure people continue with their treatment? How can we increase the number of Black and brown doctors in the healthcare workforce? Experts believe that addressing these issues may help improve cancer outcomes for all women.